Welcome to the Smarter Systems, Better Care podcast. My name is John Faulkner. I'm your host, and I'm here today with Luke Raymond. He is a seasoned health tech advisor and leader, and he serves as the EVP of Operations and Head of Strategy at Precise Behavioral. And he is working to improve access to behavioral health care and reduce costs. Thank you for joining us today, Luke.
Thanks, John. Happy to be here. Looking forward to the conversation.
Of course. So where are you calling from today for our audience today?
I live in central Illinois, the great state of Illinois, in the middle of the prairie. A lot of people consider it flyover country, but I always say Midwest is best.
Can you share a bit about kind of like your role and just how that fits into the bigger picture at Precise Behavioral?
Sure. Yeah. So I'm a therapist by training. So I'm clinically trained. I spent 9 years in a primary care office delivering primary care integrated behavioral health. Then after that, I moved into a leadership role in a health system here in the Midwest, where I was really focused on improving access to care. So that included delivering telehealth across the care continuum, things like telepsychiatry consultations in an emergency department, delivering a digital therapeutic across the enterprise, improving care coordination and navigation across all those various silos in healthcare. I did that for about 5 years and then moved over to the industry side, where I've spent the last 5 or 6 years or so really working hard on building a better system of care. And that includes the development of things like digital therapeutics combined with a deep and broad provider network to really solve a lot of those complex problems in healthcare and behavioral health specifically. So here at Precise, I lead our strategy and I serve as the executive vice president of operations. So I've got my hand in a lot of things, building out those solutions for our partners in the payer, provider, higher ed segments. And then I also work with the team on the clinical operations side.
Excellent. Thank you for sharing. And then what is your, as you're working as an EVP, what does your typical day look like for those that may not be that lucky enough to be in your role?
Yeah, it's interesting, when you're in an early stage, high growth startup, we often talk about how, you're in the weeds and the trees. So there might be 1 minute where you're having a high level strategic conversation with an advisor or an investor or a C-suite member of a health system or a plan. And then the next minute you're talking about a patient care issue with one of your clinicians or trying to figure out an operational hiccup that needs solved. So there really isn't a typical day. In these startup environments where we're doing, it's really all hands on deck all the time. And one of the cool things about the company where I am today is that there's really one of our core values is no ego. We all jump in, contribute where we can, embrace discomfort, and always kind of focus on being agile and moving the needle. So I wish I could tell you a typical day, but they're just kind of all different, man. They really are.
Yeah, it sounds like you're wearing a lot of different hats. So it sounds like an ideal position to be in. So yeah, for sure. And then as far as like your industries, like what major shifts are you seeing in the industry right now that are at play?
Well, there's a lot of shifts that are happening and have happened over the last few years. Something we've seen consistently is that there is a huge demand, but access is difficult, especially in areas where there's an acute provider shortage. Look, it's hard to believe when we say it out loud, but 60% of all counties in the United States lack a single psychiatrist. And that's even worse in rural areas like where I live. In those areas, it's upwards of 80% of counties don't have a psychiatrist. So really, we've seen that significant demand increase, and this happened during the pandemic, but we haven't really seen that slow down. And what we've also seen is that the provider shortage has continued to pervade. So there's a real imbalance in the supply of providers and the demand for that level of service. So that creates an environment where organizations need to be really creative on how we build out solutions to meet that need, and where existing incumbents in the space, so think about integrated delivery networks or provider groups, they need to be able to embrace change and have sort of a growth mindset in terms of how we build out systems of care that improve access, reduce that friction for people to be able to obtain the care, and deliver sustained quality outcomes that are also financially feasible for organizations to continue long term.
Yeah, you're looking for like sustainable growth that's, like more like a partnership working together as you go. And then you have to be flexible to the changing environment in the industry as well, from what you're seeing. So yeah. And then as far as like the trend, I think you're kind of alluding to it, like How has that trend impacted your business or growth strategy from what you've been seeing?
So what we've really kind of focused on is building out a solution that has a balance of focus and agility. And that requires a really deep understanding of the healthcare system and an approach that meets all the needs of our partners. We're lucky enough to have a practicing psychiatrist as our CEO. So we have a strong clinical voice at the top. And that really drives everything that we do because we have an understanding of what providers experience. We have an understanding of what those organizations experience. So that allows us to have a better sort of go-to-market strategy that allows for aligned incentives. And that's a deeper challenge than I think a lot of people realize. Look, I've been around a really long time in mental health and in mental health tech, and you know, one size fits all approach won't fix these problems. So, for a while we thought, hey, telehealth is the answer, and it's a significant answer, but telehealth by itself isn't enough. And then we started implementing and integrating digital tools. So things like digital cognitive behavioral therapy or AI powered triage that we deliver at Precise. That's great, but still not enough.
Yeah.
It's that hybrid model that brings everything together. AI powered triage combined with a deep and broad provider network. And that level of domain experience in the behavioral health system that allows us to deliver the really quality interventions that actually make a difference. Look, man, like I said, I've been around a long time. Healthcare is hard. It's complex,
Yeah, it
it's
is.
fragmented, it's difficult to understand, and behavioral health is even harder. But being fully transparent, we like it that way because that's where the impact is. And that's where we can drive long, sustainable, meaningful change.
Yeah, and it's like a multi-pronged approach, right? It's definitely a team effort to get the job done and get results, not only for like your company, but also for the patients as well. And those are the people you're
Yeah,
ultimately.
yeah, that's exactly right. You have to think of it in terms of, we use multi-pronged approach. The phrase you used, we often use parallel path too. Thinking in terms of how do we integrate what we do sort of at the front end of the care continuum to deliver care to people who may be pre-crisis. And then we also have approaches for highly acute situations. So in terms of providing accurate dispositions and follow-up services in an emergency department or inpatient psychiatric care. So it's having that strategic vision to identify where all those gaps in care are. And we've historically really talked about being the organization that fills those gaps for our partners. But at this point, we're moving past that. We're working with our partner organizations to actually build a new system of care. It's a common phrase in mental health that the mental health system is broken.
Yeah,
Um,
heard that a lot.
and I'm guilty of saying it myself, but I think that's a false premise. I think that the behavioral health system isn't broken. It's just never been built. There's an implication when you say it's broken that it was at one point whole and it's never been whole. So at this point in time, we're in an exciting period where there's an urgency around it. We have the digital tools, we have the virtual capability to be able to actually build that system that we should have had from the beginning.
Yeah, it's I think that's a premium insight too, is actually like there was no system essentially, right? From what we're seeing, that's why there's so many widespread issues that people are experiencing. Why it's a pandemic in itself, right? That's what I think the broader public is seeing. I think you would probably agree with that, right? So
Yeah,
yeah.
I definitely agree with that. And, I think during the pandemic, we talked about how the mental health crisis was sort of a secondary pandemic,
Yes.
but it's continued. And we've seen, to use that term, parallel path or multi-pronged approach again, we've seen multiple prongs that have kind of contributed to the problem. One of which was there was a pretty significant stigma associated with obtaining mental health care. And this still exists. It's alive and well today, especially with various populations. Only 20% of individuals who seek mental health care are men. So there's still a challenge there in accessing care for a lot of populations. But generationally, we've seen a really big shift. So millennials and youngers, Gen Z, Gen Alpha, they are not scared at all to raise their hand and say, yeah, you guys have told us for a long time that there's nothing wrong with seeking mental health care and it's just another part of healthcare. So of course we're going to listen and then try to engage in that treatment. The challenge has been that the resources that are necessary to take care of that haven't grown in scale to support that burgeoning need. So again, we're back in that phase of where we actually have the opportunity now to build a robust system that includes all of the necessary components. We're still in the early stages of it, but I genuinely believe that now is a time for optimism in behavioral health. And I haven't been able to say that for much of my career. And it's really gratifying to see those changes happen over the last couple of years.
Yeah, it's really, I'm sure, inspiring, and it makes you keep going and keeps you focused on where you envision mental health will be even through 2 or 3 years really down the road. Yeah. And then as far as like kind of the current state, like what's working for you right now, and like what's been frustrating like in your business that you've been kind of working through at this time?
Well, what's working really well is integrating behavioral health into existing points of care. So again, it's kind of at two different bifurcated points. One is in primary care. So as I mentioned, 60% of counties don't have any practicing psychiatrists. So what that does is it creates a situation where primary care providers are the de facto psychiatrists for their communities. PCPs are the ones carrying the heavy burden when it comes to delivering the vast majority of psychiatric care in the United States. There are some estimates that say upwards of 3/4 of all psychotropic medications are prescribed by primary care providers. And in many ways, that makes sense. People turn to their PCPs because this is a provider they know and trust. And those PCPs do the best they can, but they're often overburdened and under-resourced when it comes to managing behavioral health. At the same time, instead of that parallel path, we see emergency departments are taking the brunt of patients who fall through the cracks. ETs today are seeing more mental health cases than they've ever seen before, but they're not set up for longitudinal care. And, let's be honest, it's not the best place to receive or deliver mental health care. So these patients are seen in the ED. They might get a disposition to home. Upwards of 3/4 of patients who present to an emergency department for a psychiatric visit get sent home. They're dispositioned to home. They're not sent to an inpatient psychiatric unit or some kind of residential setting. And when they get sent home, there's really nothing. A lot of times, all they get is an after visit summary and an order to follow up with their community mental health center.
Yeah.
So it's really no surprise at all when these folks end up right back in the emergency department in this diabolical wash, rinse, repeat cycle. So at Precise, what we've really done is tried to build solutions that meet those needs at both ends of the system. We integrate our digital solution and provider network into primary care in a collaborative care model. Very common model now, evidence-based, to deliver that primary care behavioral health integration. So that model does a number of things. It's very evidence-based. We focus on measurement-based care and treatment to target. The other thing that we see really successfully with collaborative care is that it offloads that burden from PCPs. So instead of PCPs having to handle all of that, they have dedicated team members and digital tools that can take over that management of the behavioral health from those PCPs. Now, on the other end of the spectrum, in the emergency department, we could beam in a virtual psychiatrist. So we can say, hey, there's this high demand in certain hospitals that could never get a psychiatric provider to actually be boots on the ground there. So we can beam that virtual psychiatrist in to give a really quick and accurate disposition. And then we can provide real dedicated follow-up care with virtual visits, care coordination, those same digital tools. So as I mentioned before, this is not just fill in gaps. At this point, these solutions are allowing us to take that kind of to the next level, allow us to build a true system of care.
Yeah. So delivered at the time of need rather than having to wait on a consult where maybe that provider is not even available. Like you said, 60% may not even have a resource like that. So this at that time of delivery or that need, the doctor's like, I need a psychiatrist or a mental health professional that can get it when they need it. Right. So that's what it sounds like. You are working to deliver and expedite that for them.
Yeah, and when you got to think in terms of behavioral health is very much episodic, right?
Mhm.
So if that care isn't delivered in a timely manner when that episodic incident is at its peak, often those patients aren't going to take the necessary steps to obtain care. It's fragmented, like we said, difficult to understand. They may not even have access. They may go on their provider finder website from their insurance company and look through 15 different providers, and none of them are taking any new patients. And finally they just say, forget it. And then they might get a little bit better, but lo and behold, what ends up happening is it escalates back up to that high acuity level. And instead of delivering that care when they needed it at the time they needed it, they're back into that vicious cycle of not being able to obtain adequate ambulatory care.
Yeah. And then part of that too, if it's not working, like you said, they go back in the emergency department and they cycle out because that's usually how patients, it's more transactional, not more of a relationship. And then it just keeps cycling back, unfortunately. Yeah. And then as far as, and getting a little more in depth too, like what metric, are there's like specific metrics you're using to focus on improving um, in your business, or like what are you looking at to measure like as goals? If that makes sense.
Yeah, so metrics are part of our DNA, and we really focus heavily on a variety of different metrics, and it really depends on the use case for what we're doing. So we typically will work with our partners and we do a very sort of in-depth analysis of what their needs are. So we think in terms of metrics associated with clinical outcomes. So this could be as simple as screening patients with evidence-based questionnaires to measure the extent to which they have depression or anxiety or suicide risk or a trauma scale, and then reporting out those metrics over a period of time. We also look at operational outcomes. One thing that is critically important is reducing administrative burden on providers, operators, other members of the care team. The way we can do that is by creating metrics associated with things like time to care. So how long does it take for us to deliver a consult in an emergency department? Or how long does a patient have to wait from referral to ambulatory psychiatry until they get an appointment? And then we also work with our partners on developing financial metrics. As much as a lot of us who are clinical in background don't like to talk about it or admit it,
Yeah.
healthcare is a business.
Yeah.
And if we don't develop and deliver sustainable return on investment for these organizations, they just simply can't do it. So we take a whole really strong approach to saying, okay, what are the clinical outcomes that we want to see from this partnership? How do we improve that operational efficiency? And how do we drive sustained financial sustainability so that the program can evolve and improve over time?
Yeah, that's an excellent way to look at it because it's like two part. It's going both ways, right? It's financial. It's looking at the patient outcomes, but also the hard truth of financial return, right? In that process to make sure you can continue to support the patients as needed, right? Through that process. So it definitely makes sense.
Ideally, they're all aligned.
Mhm.
That delivering excellent clinical care also reduces operational burden or friction and is financially viable. But healthcare historically has been just so convoluted and complicated and messy. There's often misaligned incentives. And what we try to do is develop programs and solutions that actually align to all those various incentives and deliver on what we've heard of for years and years, which is the triple aim or the quadruple aim in healthcare, that we can, yeah, you can do this thing where you get strong clinical outcomes and you deliver a positive patient experience and it's financially sustainable. Oh, and by the way, let's not forget the provider experience because we have a significant provider shortage across all specialties and primary care, as well as a shortage of those providers. So we have to make sure that there's, that really strong focus on delivering a delightful provider experience.
Yeah. Those are all excellent things to hear that you're, you know, really going towards that ideal state of where you want to be and you're moving forward with your, your metrics, your KPIs, whatever you want to call them. So that's really encouraging. And then as far as like your vision, like if you have like looking down the road 6 to 12 months, where are you seeing precise behavioral? Where do you guys want to go?
All right, so let me get out my crystal ball here, right?
Yeah.
So
Or a
I think
watch.
that yeah, there's several opportunities here where I see it in the near term. I think there's a really great opportunity to do deeper integration of behavioral health into primary and specialty care settings. We have some pretty strong expertise and background in integrating behavioral health into primary care, but there's also an opportunity for additional integrations. For example, using a behavioral health model in women's health services, a key area where I think expansion can occur. How many women actually obtain their primary care from their women's health provider? So I think that's a key opportunity to be able to do for expansion. Secondarily, I think we need to be really smart and clever about how we use technology. I think there's a pattern historically where tech kind of overpromises and underdelivers. And I think the smart approach is to use tech not to replace care, as many of us in the field think, and frankly, fear will happen. But I think the right approach is to use technology to augment and amplify the care that's being delivered. AI is undoubtedly going to be huge, and its impact on healthcare is going to be remarkable in a lot of ways. So I think we have to be really, again, protracted in how we approach that. So for things like what we do here at Precise, like screening and triage, clinical decision support to improve kind of the way that efficiency and care is delivered, and reducing that operational burden for providers and operators. So things like ambient listening and then clinical documentation integrity. So we can have tech now that will be an integrated component of the delivery of care that would reduce those burdens. And those things are already making significant headway. I think one important caveat in how we think in terms of delivering AI and other tech, we have to think in terms of doing this ethically and in a person-centered way. So those are two kind of critical components to delivering tech in healthcare. I also think, and kind of going back to that financial piece, there's been a movement over the last decade or so toward value-based models. And value-based care is really the only way we can have sustainable, scalable solutions. If we're going to do that, we have to, and we talked about this a little bit ago about misaligned incentives. We have to address those. And those have driven behavioral health for a very long time. So instead of reimbursement being tied to traditional fee-for-service models that have historically driven care, those reimbursements need to be tied to outcomes.
Yep.
So yeah, of course, there's still gaps, but like I mentioned, we've got that digital tools, the urgency to fix the problem, and the right people in place to do the work. So I think in the short term, those are three big areas where I see exponential growth for us as an organization.
Yeah, that's exciting to hear. And just looking at your vision and where you want to go. And then if you had, again, back to that magic wand, I always like to ask this question. What's like one major challenge today that you're trying to solve as an organization? Like something that may be a trend or something that you really wish you didn't have to think about at night?
Well, as we've already kind of discussed today,
Yeah.
behavioral health is complex, and scaling our model that integrates digital tools, clinical services, and care navigation is not a simple process. And of course, the biggest headwind in behavioral health is always going to be workforce. We know there's that big provider shortage. And oh, by the way, those providers have a ton of opportunities to work remotely. There's a lot of organizations that are doing telehealth today. Our goal has been to tackle that head on by delivering that really positive clinical experience for our providers that we mentioned, eliminate those administrative burdens using things like native digital tools and a model of care that gives them a good experience. So we're not just throwing these providers into the fire and saying, hey, good luck. We're giving them, the tools they need to be successful.
And then do you think like some of the things that you're encountering as like a organization is being experienced by other businesses as well? Or do you think like your experience is unique to you guys? That makes sense.
I think that experience is pretty consistent across organizations. I think the difference for us is that we have historical understanding of how to address those challenges in a way that's been successful in the past. Again, going back to being led by a clinician, we have deep domain experience. In our leadership team alone, we have something like 100 years combined experience in behavioral
That's
health.
amazing. Yeah.
I also feel like we have, one of the strongest operations teams, one of the best credentialing and recruiting teams in the country, if not the best, which allows us to have a bit of an edge in how we build these solutions and how we operationalize them and set ourselves up for success with our partners.
Yeah.